Welcome back to the morning show here on Arise News. Joining me now on the show is the founder and CEO of LifeBank, Temie Giwa Tobun. Her company is currently working on the blood shortage problem in Nigeria by connecting hospitals to blood banks and blood bank donors. Well, welcome to the morning show. You are doing such amazing work. I've read about your work online and how you're impacting people's lives.
Thank you so much.
Yes, congratulations. Well done on that. So you have a background in medical health, but what made you transition into medical health, but the delivery sector?
Right. So I actually have background in health management, so the management side of healthcare. Because a lot of times people think that health is just doctors, but
right.
you have accountants in health. Mm-hmm. You have just general managers in healthcare. So I've always sort of focused on the management side of healthcare. I worked at WHO in Switzerland, UNDP in East Africa, after coming back to Africa to live here. I started thinking about medical distribution and blood distribution specifically about 5 years ago. I found an interesting data that says the largest killer of women in the world, it's something called postpartum hemorrhage. So basically a mom gives birth and she starts bleeding, and then she bleeds, and then in a few hours she dies. She goes into shock and she dies. So it's such a significant problem, and I really wanted to do something about it because I thought my education and my passion sort of came together, and that I could build a platform that could, solve this problem and solve it once and for all.
Yeah. So as you said, it's one of the biggest killers for women, but it's also it's really, you hear this a lot, that people are dying because there's not enough blood or the blood didn't get to them in time. Now you've decided to partner with Okada's bikes. So how has that been, and how are you able to even have that synergy with them and talk and get this to work?
So essentially, LifeBank is a technology and a distribution company. So we use technology to sort of build an inventory system. So this morning, I know how many pints of blood is available in Lagos, and I know where they are, and I know how long it would take me to get it to any hospital in Lagos.
And
so
this is using a tech
platform,
yeah.
Okay,
what's this platform?
It's called LifeBank.
So you have an app? Is this an app?
Yeah, so we built a software, a web software that sort of collects inventory information from blood banks. There are about 100 blood banks in Lagos. We have about 60 of them listed, both public and private blood banks. Okay. So we have their stock, right? And when we have that inventory, we know at any time what number of blood is available, what blood types, and how long it would take me to get to the hospital from the blood bank. So that information helps us sort of have a snapshot of the blood market in a particular community. And then the last part of what we do is distribution, which I think is my favorite part. Yeah. So we have this bike. Everyone knows Okada and how easy they can get in and out of traffic. So we just took that technology that was already commonplace in our market and sort of adapted it to solve this distribution problem in healthcare.
Right, and that's amazing. Using bikes and using technology in healthcare as well, because technology is helping so many different sectors. Right. And now I hear you're also using blockchain.
Yes.
So tell us a bit about that. How does that work? Because some of us don't even understand blockchain.
Right.
It's one of those things that's a bit difficult to comprehend.
Right. So I think blockchain is a technology. What people know about blockchain is that it powers cryptocurrencies. So Bitcoin and all those coins, and it's a little bit complicated when you think about it. But the technology itself is very simple. It's basically taking a piece of information, breaking into small chunks, blocks, and sort of storing them in distributed computers. So you can have one information, your name, stored in 500, 1,000 computers in small little chunks. So when you call the information, it puts it together by gathering information from all these chunks. So that's just the technology behind it. But why it's so important to healthcare is a lot of times safety is so important for us. One of the first things I did when I started LifeBank was sort of allocate significant chunk of our capital into building a very safe system, a state-of-the-art system. I wanted to sort of match the standard that's present in Europe, where I worked, in the US, where I grew up, to what it's present in Nigeria. I thought that the Nigerian people deserve the best. So we built a system that could transport blood in the safest possible way. We have temperature strips, we have blood boxes that were built and are used in Europe, and we have that state-of-the-art system in Nigeria.
So how is the government helping? Are they helping in any way with what you're doing? Have they come on board at all?
Right, so this new product, the blockchain product that we have called Smart Bag, it is...
Smart Bag.
Smart Bag, okay. Yeah. So it just makes a blood bag smarter. So the test, a bag of blood needs to be tested for a lot of STIs, things like HIV, syphilis, hepatitis. So the testing information is so important to the hospital that uses it. So we've found a way to sort of store the testing information onto the blockchain so that it cannot be edited by anyone. It is immutable and it's present all the time. So that our goal is to make sure that it creates a safe environment. We would like to work with government. Right now, our primary customers are private hospitals in Lagos. But we think that it's so important. There's so many people dying in government hospitals that we can really, really help. So one of the ways we think we can partner with government is the Smart Bag product to ensure that they are the regulator, right? The responsibility of ensuring blood is safe in a market and in a community belongs to the government.
Absolutely.
And because we are very good, government inherently is not very good in innovation, but we're good at that. So having that sort of partnership between government and innovative startups would be very useful in solving a lot of these entrenched problems we have in healthcare.
Yeah, fantastic. So what can we expect apart from Smart Bag? Is there anything else you're working on or anybody teaming up with?
Right. So we're expanding in a few months. We're going to be in Abuja, and then we're thinking about northern Nigeria. So we're really, really expanding. We're looking to partner with anyone in the market who has interest in ideas, who has interest in innovation. We're really, really focused on innovating safety in Nigeria. We think it's so important.
Yeah, it definitely is. Thank you so much for coming on the show. Should tell us how can people reach you, the website for LifeBank? Right.
So LifeBank is lifebank.ng, very simple. I'm on Twitter all the time at TEMITE. So you can sort of check it out and come have a chat with me there.
Okay, fantastic. Well, that's all from Temie, CEO of LifeBank. And next up, we're talking the status of healthcare in Nigeria and Africa at large on Our Take. But before then, it's time for a quick break here on The Morning Show. Don't go away.